To turn now to the race for a vaccine. As we mentioned, Pfizer submitted its application for emergency use authorization from the FDA. That would allow COVID-19 vaccines to be distributed all across the country. Senator Richard Blumenthal joining representatives from the Yale School of Medicine to talk about that development today. He says Pfizer is preparing to distribute 50 million doses by the end of the year, and many will go to Connecticut.
The distribution of this vaccine will be a milestone, and we expect it to go forward literally within potentially days, because the FDA could approve it by Thanksgiving or shortly afterward.
As announced, it's shown high efficacy and good safety, and those are the results that will be sent to the FDA today for determination on approval.
Senator Blumenthal says, according to federal officials, he estimates the Pfizer vaccine will be available by the middle of next year.
Between Pfizer and Moderna's coronavirus vaccines, here's a breakdown of what Connecticut could get. The state expected to receive 770,000 doses in the first wave of distribution at 2 doses per person. That's enough for 335,000 people, a little under 10% of the state's population. And because they both appear to be 95% effective, in a way, they're interchangeable.
I would not concern myself with which one to take. The fact that we have 2 is the good news in and of itself. So just get vaccinated, and we just need to make sure as your partner or whoever the vaccinator is that you get the same vaccine that you got the first time on the second occasion.
Now, there's a difference, though, on how they're stored. Moderna's vaccine only requires a regular freezer to store. Pfizer's requires temperatures close to 100 below zero. However, the Vaccine Advisory Group went out and bought the technology for Connecticut, so 10 hospitals in the state have the technology and more than enough room to store the first wave of vaccines, we're told. So as for who gets the vaccine first, the state's going to target first responders, hospital workers, and the most at-risk people. The group will also try to identify COVID hotspots in the state for even greater prioritization. And be sure to join us at 4:30. We are continuing our conversation with Connecticut mayors and the challenges their communities are facing in the COVID-19 fight. We are going to be joined today by Bloomfield Mayor Suzette DeBeetham Brown, Bristol Mayor Ellen Zoppo-Sasu, and West Hartford Mayor Sherry Cantor. That's coming up in about 20 minutes, so stick around for that.